Do you frequently feel like your heart aches sometimes? Well, it might not be your heart at all. Sometimes the real issue could be something deeper, like constant tiredness, a sore throat that won't go away, or even swollen glands in your neck. Imagine feeling so exhausted that even after sleeping 10 hours, you still feel like you've run a marathon. That's what it's like for many people with infectious mononucleosis, often called mono or the kissing disease. It mostly affects teens and young adults, and though it's not usually serious, it can knock you off your feet for weeks. Think about missing school, sports, or hanging with friends, all because a tiny virus is making big trouble inside your body. So, what actually causes mono? It's mainly caused by a sneaky virus called the Epstein-Barr virus, EBV. Imagine this virus as a tiny burglar that breaks into your body through saliva. Yes, spit. Have you ever shared a drink, eaten with someone's fork, or kissed someone on the mouth? If yes, then you've shared saliva, which is the main way EBV spreads. It's like passing a virus in a secret handshake. Once inside, EBV targets your white blood cells, your body's soldiers, and starts multiplying. Your immune system fights back hard, but that fight is what makes you feel so sick. Most people get EBV at some point, but not everyone develops mono. Kind of like how not every house a thief visits gets robbed. What are the real-life signs that you might have mono? Let's play detective. Do you have a sore throat, so bad it hurts to swallow, even water? Is your neck swollen, like a chipmunk storing nuts? That's lymph nodes working overtime. How about feeling tired like you stayed up for 3 nights gaming? That's not just laziness, it's a classic mono clue. Other hints: fever that comes and goes, headache, and sometimes a rash if you take the wrong medicine, like amoxicillin. Imagine being so weak that climbing stairs feels like hiking a mountain. These symptoms usually show up 4 to 6 weeks after catching the virus. So if you kissed someone or shared a soda last month and now feel awful, EBV might be the culprit. How do doctors figure out if it's mono? They don't just guess, they test. First, they ask about your symptoms and check your throat and neck. Then they might do a monospot test with a drop of your blood, kind of like a glucose test, but for viruses. It gives results in minutes. Positive means mono is likely. Sometimes they run a full EBV antibody test to be extra sure. Now treatment. Here's the truth: there's no magic pill to kill EBV. Antibiotics don't work, they're for bacteria, not viruses. So what helps? Rest, rest, and more rest. Imagine your body is a phone battery. It needs to charge fully before you can use it again. Doctors say, avoid sports to protect your swollen spleen, drink lots of water, and use medicines like acetaminophen for fever or pain. No partying, no energy drinks, just slow and steady recovery. Can you stop mono before it starts? Since EBV spreads through saliva, the best rule is don't share what's in your mouth. No sharing drinks, toothbrushes, or lip balm. Think of your cup and your toothbrush like your underwear, personal and private. Kissing can spread it too, so be careful about that, especially if your partner is sick. There's no vaccine yet, but good habits help. Washing hands often, not touching your face, and covering your cough are simple but powerful shields. If a friend has mono, give them space and kindness, not germs. Prevention is like putting on a seatbelt. It doesn't guarantee safety, but it lowers the risk. Scientists are working hard. One exciting area is the link between EBV and long-term health issues. Recent studies show that EBV might turn on other diseases like multiple sclerosis, MS. Think of EBV as a hacker that doesn't just crash your system once, it might come back later to cause more problems. Researchers are now testing vaccines to prevent EBV infection altogether, kind of like how the HPV vaccine stopped a virus before it causes harm. Other studies are looking at antiviral drugs that could target EBV directly. Also, long-term fatigue after mono, like long COVID, is getting attention. The goal: help people recover faster and avoid future issues. Science is moving, and hope is on the way.